I want you to listen to these numbers. You probably know someone who's been involved in this. All men, about half of all men over 50 years of age have an enlarged prostate, also known as BPH. Incidence of this condition increases as a man ages, and chances are if a man lives long enough, he will develop an enlarged prostate, or BPH, which is most often associated with frequent or urgent urination, especially at night. Fortunately, there are more tools to treat BPH, including some new procedures that can be performed in a doctor's office, such as South County Urological, and Dr. Salim Hamwatma is a Mayo Clinic trained board certified urologist and one of its physicians there. We welcome you to the program.
Thank you. Pleasure to be here.
Let's talk about this a little bit. Not always an easy thing to talk about. We're guys. We'll act like nobody's in the room but us. What exactly is an enlarged prostate?
So BPH is important to note that it's a non-cancerous condition.
Okay.
And as a man ages, the prostate grows and can cause urinary symptoms.
Which is why we see such a high incidence.
Correct.
But it's not cancer.
Correct. The reason for the symptoms is the prostate squeezes the urethra, which is the tube that carries urine from the bladder to the outside of the body. And as you said, if a man lives long enough, he will develop BPH. And the symptoms include weak stream, frequency, getting up at night, having the sudden urge to urinate. If you're one of these guys that goes to the Cardinals or Blues game and you're standing at the urinal longer than everybody else, stopping and going,
Or
not
more
emptying
often.
your bladder completely, you may have BPH
Okay.
and should see a urologist.
Okay. Now there's a lot of new ways to address this, including a Resume. Is that what you
Resume,
call it?
correct.
Resume, I'm sorry. Tell us about Resume.
So while we offer all treatment options for an enlarged prostate at South County Urological, we're particularly excited about the Resume,
Okay.
which is a minimally invasive in-office procedure to treat enlarged prostate.
Oh, okay.
It uses 9-second bursts of steam that target the portion of the prostate that blocks normal urinary flow. So with time, that tissue shrinks and a man can see relief of symptoms in as little as 2 weeks and continues to improve to 3 months. A benefit of the Resume is that you don't have the sexual side effects that you can see with other medications and other treatment options for BPH.
That's a big problem for a lot of people for a lot of men when they know that they're going to have treatment, but also to say minimally invasive in that part of a man's body or anybody else's body.
Correct.
That takes a lot of the stress out of
Yep.
the equation. And then also the green light laser.
Yes, the green light has been around longer than the Resume. Instead of steam, it actually uses a laser to treat BPH. There's excellent long-term data, minimal side effects, can also be done in office.
And there are other treatments as well and other options for patients, but you don't know until you ask. Thank you, sir.
Correct.
Very good to see
Thank
you,
you.
Doctor. Thank you for coming in. You can find South County Urological on West Bend Drive. Give them a call at 314-843-8000, or you can check them out on the web at southcountyurological.com.
Gentlemen, thank you.